Hello everyone, my name is Emmanuele Naethen Tjong. My friends and family refer to me as Nathan, and I will be delivering my speech, and it is titled The Surging Pandemic of Sugar. Now I shall start my speech with a question. What is diabetes? Diabetes is a condition which is a consequence of having too much sugar in your blood, in short. Diabetes is a commonly known problem throughout the world because as of 2021, approximately 19.47 million people are afflicted by diabetes. And diabetes does not only cause discomfort, but it also leads to deaths. And the deaths caused by this disease is not uncommon. According to an estimation by the IDF, or the International Diabetes Federation, around one person dies every 5 seconds because of diabetes. Diabetes can also become problematic in different ways, such as, let's say you got infected with another form of sickness on top of having diabetes. A common example that people would understand nowadays is the current global pandemic, the COVID-19 virus. Maybe, as you may or may not have heard, people affected by this virus and happen to have diabetes, they suffer more severe symptoms than the average COVID-19 patient. Diabetes also has many other problems, mainly related to thickening blood. Now, what should be our concern about diabetes? Well, there are two main types of diabetes people know, which is type 1 and type 2. Type 1 diabetes is when your body's immune system malfunctions and begins to attack your pancreas. This will result in your pancreas not producing insulin. And if there is no insulin, your body cells will not use up the excess sugar in your blood, meaning that the sugar levels in your blood will remain high after eating something. And in type 2 diabetes, however, it can be caused by a passive lifestyle or sweet snacking habits. The occasion with type 2 diabetes is when your sugar levels are high for a long amount of time, also called chronic. This leads to your cells building up resistance towards insulin, meaning they won't respond to insulin. And when this happens, like in diabetes type 1, they will not take up the excess sugar in your blood, meaning like in type 1 diabetes, your sugar levels will remain high. The main issue is the fact that it is not difficult to let this disorder emerge from our bodies. These symptoms of diabetes include unquenchable thirst, frequent urinating, and unexpected weight loss. The dangers of diabetes include increased risk of stroke, heart problems, kidney issues, optical health problems as well, and let's say you receive an open wound, it would be slower for you to recover because your blood is too thick. And it also increases your risk of having dementia or Alzheimer's. Therefore, detecting this disease early on is crucial because as of now, we still do not have a cure for diabetes, for both types of diabetes. And this becomes also a problem again when we relate this to our current global pandemic because COVID-19 symptoms become worse because the blood is too thick inside the patient. And this info, however, should not make us lose hope because we can significantly reduce the implications and the impact of diabetes, the negative impact of diabetes, through a healthy lifestyle and a balanced diet. And if you are a person not affected by diabetes, then taking prevention measures is also crucial for you because I believe that prevention is better than trying to recover from diabetes. And you can do this by maintaining a healthy diet and also a daily exercise routine. It is also important for you to avoid binge snacking, or in other words, eating sweets a lot, like almost every second maybe, or every minute or hour. Just reduce eating sweet things most of the time. And I believe if more people start to paying attention to these little details, the cases of diabetes, I believe, would subside a lot faster than our current global pandemic. And not only that, it may also aid the recovery and also lighten the symptoms of people less fortunate enough to be infected by this global pandemic. And with that, I bring a close to my speech. Thank you everyone for listening. Goodbye.